Hi, I'm Dr. Yuval Bibi. I'm a board-certified dermatologist, and I'm on a mission to help people get over their sensitive skin and other skin ailments and live life free of those distractions. Hair loss is a very common problem affecting over 50% of the population. There are many different types of hair loss. It is not a monolith. It is not just one thing. Hair loss, or alopecia, which a lot of people mistake for something different than hair loss or more serious than hair loss, are actually one and the same. Alopecia is hair loss, and hair loss is alopecia. Now, hair loss does affect different demographics differently. African American women or black women in the United States suffer from very specific hair loss conditions that are difficult to treat and often start treatment very late in the game. And several of those conditions require early and aggressive treatments, so early detection is key. So I'm here to raise awareness to these hair loss types and have you, if you're suffering from any one of these hair loss conditions, have you pick yourself up, go see your board-certified dermatologist immediately. The first type of hair loss that I've discussed previously, and I wanted to rehash, is central centrifugal cicatricial alopecia, otherwise known as CCCA. This is a nasty form of hair loss that starts in the middle of the scalp, hence the name central, and progresses outwards, hence the name centrifugal, because it actually progresses outwards centrifugally, as in outwards in a circular form, creating a large bald spot in the middle of the scalp over the course of years and decades. Many women suffering from CCCA end up seeing a dermatologist years or decades after the condition has started, when it's already created a lot of damage. Now, this is a scarring type of hair loss that does have an inflammatory component. There is obviously a genetic component that dictates who will get it and who won't. The condition does affect other people. So it affects women that are not of African descent, although it's pretty rare, and it does affect men of African descent, and is likely in many cases mistaken for male pattern hair loss because of the similarity in appearance of those conditions, especially in the early stages of hair loss. Now, why do people get the treatment late in the game? Well, there are several factors. First of all, awareness. Some of the people that I've seen thought it was just a natural part of growing older. Some of them are ashamed and they hide their hair loss until it's really late in the game. And some people simply don't know who to actually turn to or go to address this issue. Now, because CCCA has an inflammatory component to it, I do recommend for all CCCA patients to decrease or avoid their hair grooming practices that are leading to irritation. So shampooing needs to be minimized because it does actually abrade the scalp and the hair, leading to dryness and potentially leading to sensitization of the scalp. All sorts of application of heat devices like hot irons or hot blow dryers, which can really wreak havoc on the hair. I tell people to try and avoid those altogether. And then there are other practices such as relaxing the hair, especially when it comes to lye relaxers, which are really abrasive on the scalp and can burn the scalp to a crisp, leading to chronic irritation and inflammation when that practice is carried on for a long period of time. So those practices need to be mitigated, if not stopped altogether. Leave-in conditioning of the hairs and the scalp is a terrific way of mitigating the dry hair, which is usually associated with CCCA. How do you do it? Well, you can use a real greasy member like white petroleum jelly, which is extremely effective, especially in the very dry hair cases. You need to watch the amounts, apply a very small amount, and basically just massage it at the ends of the hair, making the hairs nice and soft. Overnight application under a shower cap or a do-rag really helps in many cases and helps you avoid staining your pillowcases. That's a great way to do that. Other types of leave-in conditioners are coconut oil, shea butter, which is a little grainy, so melt it between your fingers before you massage it into the ends of the hair. And then there is Butter Oasis Moisturizing Balm, our own all-purpose moisturizer, which works really well as a leave-in conditioner, especially on dry, fragile hair. This is made with shea butter, cocoa butter, and argan oil. It's a fantastic leave-in conditioner. Consider this product for your leave-in conditioner. So now you've stopped abrading your scalp and creating more damage, and you are moisturizing or conditioning the hair and the scalp. What else is to be done? So now we come to treatment. Treatment of CCCA consists of several elements. One is stopping the inflammation. This can be done by topical or injected steroids to the scalp in clinic or by prescription medication. There are other forms of doing that through systemic antibiotics in certain cases. And then we need to take step number 2, which is to induce hair growth. Now, this is very slow to take effect, but several hair growth agents can work and can help you out. Specifically, minoxidil is the most commonly used hair product that will induce hair growth if there is hair to be grown in their follicles that can actually respond to that stimulus. Minoxidil can be applied topically, which is an over-the-counter product, or can be given through tablets, which can be prescribed by your dermatologist. And in step number 3, help along with more techniques such as topical metformin, 10% cream, which can be applied to the scalp twice a day. This is often a compounded medication that can be prescribed by your dermatologist and can add to the efficacy of the overall treatment I just described. The treatment does work in many cases, as in stopping the hair loss from progressing and sometimes even growing hair. It may take a few months for you to start seeing results, so you have to be patient with it. You have to stick to your guns, but don't give up. Work with your dermatologist to grow your hair back. Work with your dermatologist to stop your hair loss and hopefully grow some of that hair back. Hair transplantation can be employed in cases of CCCA, often as the last resort because it is very costly and may not take. But if you're in that ballpark of patients who have not gotten any traction or any advancement with the combination treatment prescribed by your dermatologist and have gone through several iterations of treatment, maybe hair transplantation would be something to consider. So in summary, CCCA is a chronic scarring type of alopecia that affects middle-aged black women primarily. It is an inflammatory condition, so your first step is to decrease the irritating or pro-inflammatory practices to your scalp, then condition your scalp and hair with leave-in conditioners to bring back that softness, bounce, and shine to your hair and calm your scalp down. Then stopping the inflammation by using topical steroids or antibiotics, and then inducing hair regrowth with minoxidil or similar medications assisted by topical metformin, which in many cases is a game changer that'll really up your game in treating CCCA. Traction alopecia is another very common form of hair loss that does affect black women primarily. This one, unlike CCCA, can actually show up very early in life, and I've seen girls as young as 5 or 6 who've had traction alopecia. The condition usually appears in women's 20s, 30s, or even 40s, and it is directly related to hair grooming practices, specifically very tight braiding or styling of the hair, which keeps the traction or keeps pulling the hairs chronically, which eventually leads to the hair bulbs giving up and loss of hair follicles over the area that is affected. Traction alopecia usually appears on the frontal and temporal scalp, meaning right here on the sides of the scalp, but it can appear anywhere on the scalp depending on the person in the hair grooming practices applied. This condition is considered a scarring type of hair loss, but there are ways of growing back the hair. Now, addressing traction alopecia intuitively involves stopping pulling on the hair effective immediately. So if you're engaged in practices that are pulling on your hair, tight braiding, tight styling of the hair, and other practices, you have to cease those practices effective immediately. If you have to braid your hair or style your hair, you have to do it in a very loose fashion. So don't pull on those braids or knots too tightly. Make sure that they're loosely fitted and that you're not feeling constant pull or burn or tightness on your scalp. Those would be pretty good signs for you to know that you've gone too far. So back away from the tension and the traction on your hairstyling practices. Avoid aggressive combing of your hair. The hair needs to be combed by holding the hair shaft in the middle and combing away from the hair shaft very, very gently, rather than just brushing cavalierly, grabbing the hair with the brush and just aggressively pulling on the hair. That needs to be stopped. And I would venture to say that you probably want to mitigate, minimize, or even stop altogether any abrasive practices that you apply to your scalp. Those can actually add insult to injury in your traction odyssey. Conditioning the hair in the scalp can add to the well-being of the hair shafts, especially the areas that you're treating. So make sure to use a leave-in conditioner over those areas to soothe the area and add a protective layer to help the skin catch up and recreate its own skin barrier elements, as well as decrease hair breakage, dryness, and fragility. Traction alopecia can respond to a combination of topical or injected steroids as well as minoxidil. In some cases, platelet-rich plasma can be used. Now, this is a technique that involves drawing your own blood, separating the blood from the platelets in the plasma, concentrating the platelets in the plasma further, and injecting it into the treatment area. I've seen some pretty remarkable regrowth in traction alopecia cases with platelet-rich plasma or PRP. Platelet-rich plasma is considered a cosmetic procedure, so you will be paying out of pocket for that procedure. It usually costs anywhere from a few hundreds to a few thousands of dollars per session, and you would likely need about 3 to 4 sessions a month apart for you to start getting the improvement that you're looking for. So it does require some investment up front, but in many cases it is well worth the price. Consider using platelet-rich plasma if your initial efforts to regrow the hair have not worked as you had expected or wanted, and you really need that boost. So in summary, traction alopecia is a form of scarring alopecia that affects African American women as well as other people of all age groups, but it can appear very early on. It is directly related to hair grooming practices, specifically tight braiding and styling of the hair that creates chronic traction on the scalp and the hair bulbs. Treating traction alopecia involves withdrawing from any practices that have brought the condition on, so obviously no more tight braiding or styling of the hair. You need to loosen up those braids and those knots and make sure you do it very delicately. Mind your combing as well. The condition does respond to topical or injected steroids as well as minoxidil, either topically or in pill form, and in some cases you may have to resort to platelet-rich plasma to improve your condition. There are other treatments available out there. Check with your board-certified dermatologist to see which one is the best fit for you. If you have enjoyed this video so far, don't forget to give us a thumbs up. Also, don't forget to subscribe to the channel and share this video. Now let's move on to the next condition, which is alopecia areata. Alopecia areata is a non-scarring type of hair loss, which is autoimmune in nature, meaning immune cells attack the hair follicles and induce shedding of hair over certain areas on the scalp. The condition usually appears as circles of hair loss that arbitrarily appear on different areas of the scalp. It can affect other parts of the body like the eyebrows or the eyelashes, but it is usually more prominent on the scalp. And then there are severe cases where the condition can actually take out very large areas of hair on the scalp and cause extensive baldness on the scalp. Now, alopecia areata can usually be treated with topical or injected steroids. Injected steroids are usually preferred because they take the workload off your narrow shoulders, and all you have to do is show up to clinic and get injected over the affected areas once a month in clinic until the hair comes back over those areas, in which case the treatment is stopped. Topical treatment requires you to apply the medication to the scalp yourself. Alopecia areata, especially in the worst cases, can be associated with vitamin D deficiency. So if you're suffering from chronic alopecia areata, very resistant alopecia areata, or very widespread alopecia areata, or otherwise suspect that you have a vitamin D deficiency, check your vitamin D levels. You may need to supplement those levels. Supplements are recommended or prescribed by your dermatologist based on your blood work results. Be sure to check with your dermatologist to see if you're vitamin D deficient and require supplementation. Telogen effluvium is another form of non-scarring hair loss that can affect the entire scalp. It usually starts as massive hair shedding over the entire scalp, which in many cases follows 3 months after a major event in a person's life. So major illness, major surgery, death in the family, God forbid, other forms of significant and infrequent stress, such as childbirth, maybe starting a new medication, things like that. So if you're experiencing heavy shedding of hair 3 months after a major event in your life, chances are that this is telogen effluvium. In certain cases, telogen effluvium is actually related to systemic issues, especially in the chronic variety, where it actually fails to reverse itself and continues on for well over a year, sometimes continuing for many years on end. Now, this condition can be related to vitamin D deficiency, thyroid disorder, and other forms of nutritional deficits, so be sure to check with your dermatologist if you're in that category that may require that workup, and find out if you have any deficiencies that need to be corrected. Because if you do, those deficiencies must be corrected before the hair loss can be reversed or improved. The telogen effluvium, besides supplementation, in case it doesn't turn around, can be treated with various hair growth inducing medications. Minoxidil is the most commonly prescribed medication for chronic telogen effluvium. Check with your board-certified dermatologist to see what category you fall into and see if minoxidil or any other treatments are right for you. So hair loss in Black women presents special challenges and requires specific expertise on the part of your dermatologist. If you're suffering from hair loss, do not wait. See your board-certified dermatologist today. Find out what condition you're suffering from. Find out what your options are and manage this thing through, making sure you get the most bang for your buck. Also, let me know in the comment section, what type of hair loss are you suffering from and how have you addressed this hair loss so far? If you've enjoyed this video, don't forget to give us a thumbs up. Also, don't forget to share this video and subscribe to the channel. For more information about skincare scams, shenanigans, tomfoolery, and hair loss, as well as other skin conditions and how to address them in the most cost-effective way possible, pick up my book, 6 Skin, Skincare Made Simple on Amazon.com, now available in audio. Thanks for watching. God bless.